Welcome, David. How are you today?
Hey, thanks, Steph. How about yourself?
I'm really well, especially now that I get to have another chat with you because last time we chatted on our podcast, I took away so much amazing information, which I've actually applied a lot of it. So thank you so much. But I think we've had such an incredible reception to all of the incredible work that you do with ABIC. So thank you so much for coming on our live today.
Yeah, it's my pleasure.
Well, it's wonderful. We're going to be talking again about, changes in the skin, especially when women are heading to midlife, and especially when it comes to do with, what types of treatments do we select for, these type of aging situations? Do we go with heat-based modalities or do we go with other type of rebuilding? But before we do, we really would love to get your take and understanding on like our skin evolves with age, and we often talk about collagen decline and hydration loss, but what are the, I suppose, less obvious physiological changes that we see that truly I think define aging skin?
Sure. It's an interesting question because I think people make a few assumptions. I mean, they assume that once they get to know their skin, they know what products work for their skin, that's going to be the way it is forever. I think that's the first assumption people make. And then I think they assume that a lot of the stuff that they see with aging, a lot of the changes they see with aging, are related to things like environmental factors like ultraviolet light, age itself. I'm getting old. I've got to expect that I'm going to have some wrinkles, and maybe some other factors, perhaps like alcohol or smoking and those sort of things. But I don't think people have really thought too much about what changes that happen with our body as we get older. For example, menopause in a woman, what sort of effects that has on the skin. And I think that's something that's only become recognised fairly recently.
Very true.
And I guess given that we're talking about menopause, that's probably where we should focus our attention anyway. But estrogen is really important for skin. And it's one of the things that makes women's skin different to a man's skin. Man's skin tends to be coarser, there's more hair, there's more sebum usually in male skin. The skin is thicker, and that's due to the action of testosterone and anabolic hormones primarily. And similarly, women's skin is different because of the effects of estrogen primarily. So you're going to get that softness, that plumpness, the inhibition of hair growth that's characteristic of female skin. So I guess if you think about menopause and the fact that you get estrogen deficiency at that part of your life, you get that sort of winding back of those factors that make a woman's skin typical of what her skin is like when she's younger. So I guess that's the main changes that occur.
So I think there's also something to be said for external and lifestyle factors. How much is actually driven by hormones versus these external factors?
It's hard to put a number on it, I think. I think it's really going to be a combination of both. I mean, I always think about the twin studies that I saw as a medical student, where one twin was a smoker and had a lot of sun exposure and the other one didn't. And you could see dramatic differences between those two women. And I think you would have to say that those are primarily environmental driven. And there's no doubt that as we age, there are genetic factors as well. I mean, it's probably an oversimplification, but the genes associated with wound healing and repair and reducing inflammation tend to get turned off, tend to get a bit lazy as we age. And that creates some of the changes that we see in our skin. And then there's also the hormonal factors. And part of that is due to age. Age is what causes the ovaries to stop producing estrogen. But I don't think it was well recognised the impact that the estrogen itself had on the skin. I think we all thought it was just aging.
Mm. It has so many impacts. I mean, if we're talking about now menopause and even skin permeability, like as women move through menopause, they found that skin permeability and the barrier function changes dramatically. What's actually happening there, I suppose, on a cellular level that could alter the skin's, even the response to ingredients and treatments?
Sure. So I think to understand that, you need to have a little bit of an understanding of what estrogen does on the skin. And there's actually two pathways with regards to the effects of estrogen on the skin. There's a genomic pathway, that is a gene-mediated pathway, and there's a non-genomic one. So simply put, the non-genomic one is just the effects the estrogen will have on the skin in general. And the genomic one is things like what happens with hair growth, for example. And I guess the best explanation of that is, what you see with female pattern hair loss, for example. So estrogen has multiple different effects on the skin, and some of them are going to affect the production of collagen. And we mentioned collagen loss before. So there's a 30% loss in collagen in the first 5 years after menopause. And 2% per year after that. There are changes definitely in the metabolism of the skin and the health of the extracellular matrix, and hence, the hydration of the skin naturally with, hyaluronic acid and the function of the skin, which impacts then on the repair of the skin. And all of that will contribute to things like permeability. So one of the factors, or one of the changes that people will be more aware of, other than things like the skin thins, it loses its firmness and elasticity, is that it will tend to become drier as well. And it can become more sensitive, like you said. And I think the sensitivity is ultimately going to be due to a number of those factors combined.
Okay. Well, the actual permeability changes back to that. Should we be actually rethinking the actives that we use on our skin, and possibly even the delivery methods we use in perimenopause and postmenopause?
Absolutely. So, and that comes back to what I was talking about earlier, I guess, Steph, that, we think our skin's going to be the same throughout life. And so once we find a skincare regimen in our 30s, let's say, that we're happy with and we feel is good for our skin, we sort of expect that that's going to be the right stuff to use for the rest of our life.
Exactly.
But your skin does change. And so I think you need to be prepared to make those adjustments. And, one of the things that I think is really important is that as you reach menopause, there are skincare products now that can actually help menopausal skin through actives that will trigger the estrogen receptors, the very hormone that's missing. You can actually treat with topicals. Now, it's not to say you forget all of your skincare that you've had in the past, but you need to adjust it. With regards to dryness and permeability, you may change the sort of cleanser you're using, for example. If your skin's producing less natural oils and hydration, maybe you want to shift towards an oil-based cleanser rather than something which is going to exfoliate or strip the oils out of the skin. So simple things like that. And I think people tend to resist change in general. We get in a habit, this works, so we're going to keep on
Of course.
working that way. But I think you do need to be open to understanding what's happening and then trying new things.
Oh, I hear you. And I mean, this month is menopause month, of course. So we're recognizing that. It's a really timely discussion as well. Lots and lots of people are starting to really understand, or even be aware that this is, not just an internal thing is happening to us, but aesthetically speaking, the changes could be very well driven by that hormonal change. And you were talking about Emapel earlier as well. I do need to try that because it sounds so incredible with regards to what it can do, because I'm in the obviously perimenopausal stage of my life. I just turned 50. So I think that having those types of options for women is extremely empowering, because it's something specifically for us. And there's so many other changes that are happening to our skin. You just mentioned that our skins can become more reactive. I mean, we hear that mature skin are more reactive, or more sensitive, if you will. What's actually happening there physiologically? Why does that happen to us?
I Look, I like to make things fairly simple for myself. It's a way I can understand things. And whenever someone talks about reactive or sensitive skin, to me, that usually means that there is a problem with the barrier function of the skin. For whatever reason, the barrier is not working the way it did in the past. And so things that we might be applying, we become more sensitive to. And I think when you think about the things I said before with the changes in the extracellular matrix, the reduction in natural hydration of the skin, and the fact that as we age, some of the genes associated with repairing and maintaining our skin are not working as well as they did when we were younger. I think all of those combine to making the skin more reactive. So I think, again, it's multifactorial. I think that, menopause in effect draws a line in the sand. It's a point in time that you can identify, and so you can think about what your skin's like before and what it's like after. And certainly with the withdrawal of estrogen, you definitely see a big change in your skin. We sort of mentioned that during the podcast we did about a month ago. So I think, being around the age of 50, that's sort of the line in the sand where you sort of say before and after, and then you can see those dramatic changes. But I think the changes are actually quite gradual, like the reduction in hormone levels. It's just that you find that at some point in time, you really get to see that impact. I guess it's a bit like having your hair coloured, it's okay, it's okay, it's okay. And then one day you wake up and say, hang on, it's not okay anymore, I've got to get it done. But in actual fact, that change has been gradual over a period of time. It's just you notice it at one time.
And inflammation is gradual. Is inflammation, I suppose, the biggest enemy here, or is it more about the reduced ability for the skin to actually recover, in peri and post menopause?
So if you've got impaired skin barrier and, say, sensitized skin, then it can become more easily inflamed for sure, because some of the things that you're putting on the skin may cause that inflammation. And once the skin is inflamed, even think products that you can normally use and seem to be well tolerated normally can seem to have an inflammatory or an adverse effect on the skin, it can make the skin worse. So yes, I do think it all comes back to barrier function in most instances, because I think if you can improve the barrier function, reduce the sensitivity, then the inflammation reduces as well. They're hard questions, Steph, because it's all tied in together. It's not like there's one simple answer for any of these sort of things, but it's important to think about all of that. And I think sometimes people don't recognise that one follows from the other, and that you need to, treat the inflammation and the sensitivity before you can get back on track again.
Yeah, absolutely. And then obviously for those of us that have clinics and we treat patients, it's a choice. It's like a choice that you have, or really, you need to really assess the client, because we're used to, I suppose, heat-based modalities. We're used to putting a lot of pressure on the skin to create a change. But how would you adapt, I suppose, treatment protocols for a client that whose their skin just doesn't bounce back the way they did before?
Yep. So that loss of bounce is something that you see definitely as people get older. I think multiple factors are important there. You get a decrease in skin thickness, decrease in collagen, decrease in elasticity, decrease in hydration, like we've said. And I think all of that sort of leads to that loss of bounce that you're talking about. But I also think that it does affect the efficacy of energy-based devices and heat-based treatments as well. I mean, I think we all recognise that it's harder to get that improvement in skin quality, say with radiofrequency microneedling, beyond a certain age. I think there are things that you can do to help enhance it. There are regenerative treatments that you can provide the skin with to help enhance the production of hyaluronic acid, collagen, and elastin. I think there are topicals that you can use to also enhance that as well. There's a lot of discussion as to whether taking collagen supplements will help that. And the analogy might be that if you're going to go to the gym and do some weight training to get bigger muscles, you want to make sure you've got enough protein in your diet. And so people are sort of saying, well, maybe with the skin, we should be doing that as well. There's not a lot of collagen in our diet compared to, say, 50 to 100 years ago. Our diets are quite different, more refined, or more refined foods, I should say. So I think there's a lot of things that you can do to help improve that bounce, but definitely it does get harder as you get older. Having said that, again, if I go back to some of the topical products like Emapel, it's never too late to use it because the estrogen receptors actually, through the use of something like Emapel and the MEP technology within it, that actually increases the number of estrogen receptors over time. And so it's a positive feedback loop. So, like, I guess it comes back to what you said before, that you have to rethink things and approach things differently. It's not that you can't do things to get results. You just need to think about it and do it a little differently.
There's so much to it. Speaking of hydration, you mentioned it. You know, a lot of clinicians, we focus on external hydration. Obviously, that's a part of it. You know, the right type of serums and the right type of treatments to boost hydration. Obviously, drinking water and all of that. But you've spoken about before the need to kind of feed your skin rather than, you know, simply moisturize it structurally, right, from the inside. How, like, can you unpack that kind of concept? What does that actually mean in a structural sense?
Again, going to go back to simplistic, David. To me, a moisturizer is something you stick on the skin. It's definitely going to make the skin feel better. It's going to make it more luminous. You're going to reflect light nicer. It's going to feel softer and smoother. But most moisturizers that we have aren't actually going to penetrate into the skin. And so they actually don't have a hydration effect on the skin. And so you need to think about the sort of products that you can use that are going to increase hydration. There are topicals that can do that. There's, you know, the low molecular weight hyaluronic acids probably do penetrate in. Serums definitely will. They don't hydrate in themselves, but they can start a cascade of events that helps with hydration. And like I said, there are regenerative treatments that you can use that are going to increase production of hyaluronic acid and hence hydration internally as well. So to hydrate the skin, I don't think a moisturizer is the answer. I think a moisturizer is useful, but you've got to understand what it does. It's basically something that makes the skin feel nicer. It can be occlusive. It can protect the skin depending on the formulation. But with regards to actually hydrating the skin, you know, there are better ways of doing it, I think.
When do you
That's what I mean by feeding, I guess.
Yes, perfect. And when do you think is that point where, you know, external hydration kind of stops being as effective and we should really shift to more of that internal hydration, you know, or bio remodeling or, you know, a little bit of volumetric solutions? When's that point when you're like, right, I actually need to shift to this type of treatment, and what type of treatment is it?
I think that we probably need to be doing it a lot earlier than most people recognize.
All right.
I think, you know, we start losing collagen in our skin probably in the mid to late 20s. And I think from as early as that age, you can start thinking about what sort of things you can do to improve the quality of your skin. So that I guess the analogy I use is osteoporosis. And bone mass peaks in your mid to late 20s, and then it's all downhill from there. But you can do things that'll mitigate the rate at which it's lost, so that by the time you reach menopause and you get that accelerated bone loss, you're at a better starting point, less likely to have fractures. And I think the skin probably mirrors that to some extent, that the better quality you can have your skin when you're younger, the less damage you do to your skin, the more you look after it. Then by the time you reach menopause and you get that natural decline because of the estrogen loss, you're starting from a better spot. I mean, we all know people who are in their 40s, maybe approaching 50, who look many years older than they do. And we know people who are in their 60s who look much younger than they do. And look, there's lots of reasons why that is. Like we said, there's all those factors that affect what happens to our skin earlier on. But part of that, I think, is also how well people look after their skin. And it's more than just putting a moisturizer on the skin. I think the people that have the better skin as they get older have probably started using things like serums and actives in their skin at a younger age. There's been a lot more protection of the skin through sunscreens. And, we're starting to talk about treatments that will, help collagen banking, for example. And that they tend to be injectable treatments and things like that. So I think the whole idea of regenerative aesthetics, doing it physiologically and an anti-aging approach is all evolving. It's actually a very exciting time in aesthetics, I think.
Oh,
I don't think there's one easy solution. I think it's a whole combination of things.
I wish actually I was in my 20s now because the incredible treatments are available right now and the understanding that we've got about skin. I did start in my late 20s, but obviously we didn't have access back then. That was, 20 years ago. Didn't have access to everything that we have right now. And I love that you said collagen banking. Can you explain that term?
So collagen banking is a concept where you do a treatment that actually increases the amount of collagen in the skin, let's say. You're not doing it necessarily because there is a problem there. I mean, obviously, you're probably going to notice that the skin is starting to get some laxity or loss of elasticity or is starting to thin, but you're not doing it because you're unhappy with the way you look or with the way the skin feels. You're doing things at that point in time to try and increase the amount of collagen in your skin. You're trying to boost it as much as you possibly can. We said that when you're younger, your skin reacts better to those sort of treatments, and it's harder when you're older. And that's why you're trying to do it then. And similarly, with things like Emipel, we talk about it being used at menopause or beyond, but really probably should be starting to use that well beyond menopause too.
Wow, yeah, that's blowing my mind. So even in your 30s, you could use Emipel. Start to.
Yeah, we sort of say so. Depends on the individual, but from 35 onwards, you could consider using it for sure. There's no reason why you can't.
That's brilliant. And so now shift gears a little bit, but we touched on heat-based modalities, but there is this growing recognition that some energy-based devices, might lose their impact in mature or even hormonally aging skin. Why does this happen?
Again, lots of reasons. Heat-based devices, energy-based devices ultimately rely on creating a wound, a certain degree of controlled inflammation, and then a wound healing response. And we know that older skin doesn't heal as well as younger skin. So then it's not surprising that as someone gets older and we're creating these microthermal injuries or whatever they are at the time, that you're not getting the same response as when you were younger. The reasons are for all the reasons that we've spoken about already earlier, hormonal genetic changes, sun damage. At the end of the day, I think it's just that as we age, unfortunately, our wound healing becomes impaired, and therefore modalities that rely on a wound healing response are not going to work as well. I guess that's as simple as I can put it.
Sure. And they're not they don't work as well, but in sorry, in some cases, we've heard that heat stimulation becomes counterproductive. Can that happen?
Look, anecdotally, I know that when I'm doing, say, broadband light treatment, which is a form of IPL, you need to be more careful and cautious with your settings when someone is older. The skin is thinner, it's less well hydrated, and it's definitely more sensitive to the energy you're putting in. So if you don't adjust your settings accordingly, you can definitely cause injury. In this case, it could be a burn, for example, or hyperpigmentation as a result of the treatment. So you definitely need to be mindful of those sort of things. Similarly, if your skin is thinner and you're doing microneedling, RF microneedling, you need to be conscious of the depth and the amount of energy you're putting into the skin. If the skin is thicker, effectively it's a better heat sink than if it's thinner.
Of course.
So it's much easier to cause an injury.
Mm.
And I have seen cases, with both microneedling and HIFU, as people are getting more mature, where higher settings are used, and people are actually getting fat atrophy, and people sometimes come to see me and go, "My God, I've had this treatment. Look what's happened to me. I've lost all this volume. What can you do to help?" So you do have to be mindful of what you're doing, the settings you're using, what the skin type is. I mean, I've got this sort of rule of thumb that I assess someone's Fitzpatrick skin type, obviously, before I do an energy-based device treatment. But I like to treat what I have in front of me at that time. So even a lighter, fairer skin type, if we're doing something like broadband light or IPL, at the end of summer, when someone has a tan, you're going to have to use different settings to the middle of winter when they don't.
Mm.
So you really have to assess the person you have with you at that time and try and figure out what's going to work the best for them.
Mm. Now, I get offered a lot of treatments, obviously, because we have incredible partners. But I'm starting to shy away from thermal based rejuvenation. And it's hard to, say no sometimes. But at what point, like I recognize it's at the point that I need to stop. But for practitioners, when do they kind of recognize the point where they need to pivot away from that thermal based rejuvenation with a client? What are they looking for? What signs?
That's interesting because I will use um, thermal-based treatments even for someone who's in their 70s or 80s,
Right.
but I will do that with a specific goal in mind. And I guess as you're aging, you have to try and figure out what is it that you're primarily aiming to treat. What is your goal of what you're doing?
Right.
And if you're trying to increase, say, collagen or elastin or skin thickness, then the treatments may change. Like we said, microneedling can become harder to do, and perhaps there are better treatments that you can do that are not heat-based that are going to produce better results.
Mm.
So I think it always starts by doing an assessment of the person, the skin and what the skin's like and how much inflammation's like and what you think the skin barrier is like, but then also having a think about what you're aiming to try and achieve and then trying to decide what the best way to achieve that outcome is.
Mm-mm. Being very
Um,
mindful about the consultation process and the skin.
Absolutely.
Yeah. Yeah, rather than rushing into what you know just because that's your specialty. And I feel like that's a conversation that I'm having more and more with business owners and clinicians is, don't just reach for the device because that's what you're used to, treating on, or that's what you have available to you at the time. I do really think now it's time to start thinking about and tailoring the whole, client experience to what's the best outcome for their skin at the time, is what you said. Let's move over. I've got you're really good at busting myths. Every time I speak to you, I come out with I thought that, but now that was wrong. So what are the most common myths you encounter about skin tightening and lifting? This is a particular question of mine because that's what I need. And, I'm finding everyone around the menopausal area is talking about what's the holy grail of skin tightening and lifting. What are some common myths you can bust?
I think the holy grail of lifting is easy. The holy grail is surgery. That's the way you truly get a lift. I think most other modalities can produce a mild to moderate lift, And a lot of the time it's more to do with alteration of proportions and where the light reflects off the face, and where the hollows, where the shadows and highlights are on your face, because that will create an illusion of lift. And I mean, we've been doing that for the last, I don't know, 25 years with various injectables and dermal fillers and things like that. That's what all of that's about. Tightening is trickier. I think the best way of getting tightening actually is through trying to improve skin thickness, hydration, and elasticity, even though that doesn't seem, tightening, we often think of doing an injury, you get that contraction of the tissue, so that makes it tighter. And certainly, things like CO2 lasers will work that way, but you end up with a certain appearance after a CO2 resurfacing, which isn't necessarily a natural appearance. You can often pick the people that have had that sort of treatment. And when you look at and think about someone who's more youthful, it's really, I look at several things. I look at dyschromia in the skin, how much redness there is, how much pigmentation, how even the complexion is. I look at the luminescence of the skin, how it reflects light. And, then you look at things like thickness and elasticity. And one of the things I think that it's remarkable in my practice, I learned a while ago that if you can improve the complexion and improve dyschromia, people often see past the lines and wrinkles because the skin looks better, they look better. And let's face it, who doesn't like to be told, oh, your skin looks amazing? It makes them feel good. So I think that's one of the myths, is that we don't necessarily need to fill lines and wrinkles to look younger.
And I do think that, various types of, discolorations on the skin do affect the light, and where we perceive to be a hollow might be a pigmentation, an area of melasma or something like that. Once we fix that, then, all of a sudden it does look better. But back to the tightening, do you think the word tightening is a bit misleading? I mean, the holy grail of lifting is going to be surgery, right? But if we're talking about tightening, do you think we can achieve tightening in the skin?
Yeah, look, I think you can. I mean, I think fractionated laser treatments do produce a tightening, and I think you can with RF microneedling. I think you can with HIFU. But like I said, I probably prefer I'm starting to go more towards the regenerative treatments where I can get an increase in the thickness and hydration of the skin. If I can try and increase collagen elastin in the skin and it becomes more plump and more elastic, then I think it instantly looks tighter and feels tighter. It depends on to me, you can look at tightening from a point of view of does someone have lines or wrinkles, but you can look at it also from the perspective of what does the skin feel like. And I think part of that's that elasticity. So anything you can do to improve that, I think, is going to improve that perception of whether the skin's tighter or not. At the end of the day, we all get jowly and heavy nasolabial folds, and they're difficult things to truly lift and tighten. I think we're getting better at doing it. Like I said, I keep going back to the concept of regenerative aesthetic medicine. I think there are really good opportunities there to get improvements with that sort of the things you notice with those sort of problems. But yeah, it's difficult. And I think the older you are, the harder it is to get that tightening and lifting. So we used to think of hyaluronic acid in our tissue simply as being something that attracted water and provided moisture. But over the last 10 or 15 years, we've come to recognise that it actually has a very important physiological role. And that can range all the way from being in an inflammatory response to a wound or an injury, all the way to having antioxidant, anti-inflammatory and wound healing properties. And these products work by taking advantage of the molecular weight of natural hyaluronic acid that will have those antioxidant, anti-inflammatory and wound healing properties. And so by using that molecular weight HA, you can create a product which is very similar to what natural physiological hyaluronic acid is and mimic those sort of effects. So it's a very physiological modality that doesn't involve any injury or inflammation or wound or any of the things you may get from heat or energy-based devices, for example, or from some of the other products that have been used in the past to stimulate collagen and elastin. So I think this is really the start of a whole new branch of aesthetic medicine, to be honest. And the difference between the two is that one will treat the skin and treat the skin from within, and the other will treat the subcutaneous tissue and fat. So you're getting advantages in both areas. And I think down the track, we'll probably see products developed that will treat deeper layers as well.
Really? Oof, that's very exciting. Gosh, that I love the way that the industry's heading, regenerative aesthetics and regenerative medicine. It's incredible. In your opinion, I mean, we've kind of covered this, but does this make this a safer approach for postmenopausal skins?
Safer. I think everything we do has an element of risk. Even using, therapeutic skincare, you can get reactions. So I think that you need to acknowledge that whatever product or modality you use, you can have problems that arise from it. I mean, that's just sensible. But is it safer? I think that because you've got a product which is very closely related to what natural hyaluronic acid is, and it doesn't have, for example, any chemical cross-linking, that reduces the likelihood of things like inflammatory reactions to the product.
Right.
So I think it is safer from that perspective. You're less likely to get adverse events.
Yeah.
And similarly, the techniques that are taught to administer the products have been partly designed because having safety in mind. So the techniques have been specifically designed to lower the risk associated with administering the product. So I guess in a nutshell, yes, I do think they are safer. But I think we need to acknowledge that any treatment can be associated with complications or adverse events. And I think that's why education and proper consultation and proper informed consent is really important. As people get older, I really like the concept of the regenerative aesthetics and the results you can get from it, because I think there's not much that we've been able to do in the past to regenerate tissue. And I think it dovetails really nicely into the concept of anti-aging. And it does also nicely complement, anti-inflammatory modalities. And, people nowadays, I think, are looking very closely at how they can reduce inflammation in their body in general. So if that's our general philosophy, why would we do a treatment for our skin, for example, that causes inflammation, when we can have a treatment which does the opposite?
Oh, I love that.
And on a physiological way too. So I think that that's where I see the future heading. I think we're going to see more products along that line develop as time goes on. And, I think we're starting to see some of those. But yeah, it is very exciting. I think we're moving beyond just treating the symptom, which might be volume loss or lines and wrinkles, and we're starting to get at treating the underlying causes of what we see and trying to correct them, which is really good.
Well, you've just beautifully answered my last question, which was, if there was where are we heading in the future, and if there's one message, to take away for practitioners, what would it be? And I love that regenerative medicine and looking at, what we can do in not just in the traditional sense, but more thinking broadly about rejuvenating and rejuvenation in general. And thank you so much, Dr. David Kosenko. Obviously, Dermocosmetica is a incredibly generous supplier member of the Aesthetic and Beauty Industry Council, and they have been for years. You share your wealth of knowledge and information and your time to help the industry, and we really appreciate it, and we really appreciate your support and the support of the industry, David and team.
You're welcome, and thank you for the invitation. And look, I always try to give a fairly balanced look. I don't, yes, I do work for Dermocosmetica. I'm the head of medical and clinical training, but the last thing I want to do is a hard sell. I like to really get people to understand the differences between different treatment modalities.
Thank you so much again for joining us. Please come back soon. We love you. We love having you on. So thanks everyone for watching as well. Bye everyone.
Bye bye.